The knee functions to allow movement of the skeletal frame, which requires transmission of the forces generated by muscle action and body weight. It functions to perform joint kinematics, with the primary angular motion of the tibiofemoral joint being flexion and extension, although both internal and external rotation and varus and valgus motions can occur. Passive knee flexion is generally 130 to 140 degrees, however during squatting it may reach up to 160 degrees. The patellofemoral joint functions as an anatomic pulley for the quadriceps muscle. In the knee joint, tibiofemoral translation can also occur, which is demonstrated here by using the draw test. The patella is located on the anterior surface of the knee and can be palpated by placing the knee into 90 degrees of flexion and using the thumbs to feel either side and over the top of it. Just below the patella, it is possible to palpate the tibial tuberosity, which is a bony projection on the anterior surface of the knee. Below the tibial tuberosity, it is possible to palpate the tibial shaft. On the lateral aspect of the knee, the head of the fibula can be located and is roughly in line with the tibial tuberosity. The medial and lateral tibial plateaus can be found by placing the knee into 90 degrees of flexion and sinking your thumbs into the joint space either side of the patella. The edges of the medial and lateral femoral condyles are located by placing the knee into full extension and sliding off the patella medially or laterally. Just below the patella, you can then find the edges of the condyles. The medial and lateral epicondyles of the femur are found by placing the knee into 90 degrees of flexion and feeling either side of the kneecap for bony projection. These are the epicondyles of the femur. The wrist functions to transfer the forces and motions of the hand to the forearm and proximal upper extremity. It also functions to control fine hand and finger function, to control length and tension of the finger flexors and extensors, and to provide stability for skilled or forceful hand movements. The anatomical landmarks of the wrist include the styloid processes of the radius and ulna, which are bone projections that can be felt on the medial and lateral aspects of the wrist. The listis tubercle can also be found on the medial aspect of the radius. On the palm, the pisiform can be felt through the subcutaneous tissue as a pea-like projection, and in relation to the pisiform, the scaphoid and lunate can also be felt. The extensor muscles of the wrist include the extensor carpi radialis longus, carpi radialis brevis, carpi ulnaris, extensor digitorum, and the extensor insidis, whilst the flexors of the wrist include the flexor carpi radialis, carpi ulnaris, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. The radial deviators of the wrist are the extensor carpi radialis longus, extensor carpi radialis brevis, extensor pollicis longus, and the abductor pollicis longus, whilst the ulnar deviator is the flexor carpi ulnaris. The supinators of the wrist are the biceps brachii, supinator, and brachioradialis, whilst the pronators are the pronator teres and pronator quadratus.